Hi, I'm Marcia Knight, Director of Education for Cabell County EMS. The basic EMT class is a 150-hour DOT, Department of Transportation class, approved. It is developed for the general public. It is developed for military, can be used in medical professions. It is just the basic entry level into the pre-hospital care setting. The EMT class, it can be delivered as a full 150-hour in classroom, or it can be a hybrid class with 50% of the class being online, the rest being in an in-classroom, hands-on type setting. When the class is completed, the student will complete a psychomotor skills exam consisting of patient assessment, both medical and trauma, medication administration, airway, insertion of airway devices, controlling an airway, oxygenation, as well as bleeding control, shock management. So the in-person class, again, can be delivered as a 2-day or a 1-day. The student will report to class and practice hands-on skills. Those are practice in a classroom setting as a show me the type skill that I need to perform, as well as do the skill, and then do a peer-to-peer and help your other fellow classmates as well with the skills to make sure everybody's proficient in the hands-on portion. So Cabell County EMS offers a program if a student so chooses to come into the class and follow all the requirements of West Virginia to become a certified emergency vehicle operator. Once that's complete, then they can apply for employment, and they can actually be employed as an employee for a paycheck and work as a certified driver while still attending the basic EMT course. It does two things. It gives the student some hands-on out in the field, actually having some experience with patient care, lifting, moving, driving, ambulance operation, as well as just seeing other things, that additional requirements with students that we don't normally get all in the classroom. So the emergency vehicle operator is certified in driving course, which is CVO or EVOC. It's a certified emergency vehicle operator or emergency vehicle operators course. Both of those are nationally approved classes, are nationally recognized and taught across the United States. The difference in that course that's required versus just a standard course that you may take as a standard driver's education course is it does give you more hands-on, more education for operating an emergency vehicle with lights and siren. It's a much larger vehicle, not being able to use your mirrors, not being able to see through the back. There's lots of different things that are involved. In addition to the driving course, the student must also complete a first aid course. They must also complete a CPR course, a hazardous materials operations awareness or tech course, and as well as a mass casualty incident to know a little bit about triage and introduction should they be responding to a mass casualty. A mass casualty is any incident where the number of patients outweigh your number of resources. Could be very large scale, could also be something more on a small scale. Teaches our students how to respond to those types of courses, how to triage patients, how to sort patients according to their injuries, and who needs to go in the highest priority, who can go in middle priority, who can wait. Those are what we call the walking wounded. Also gives them some orientation to the West Virginia triage tag that is supplied on every ambulance in West Virginia. So they get familiar with how they should respond and how they should function once they arrive on scene of a mass casualty, and we define different roles as well. So in West Virginia, basic EMT can administer medications. There's actually 11 medications that an EMT can administer. Those being respiratory drugs such as albuterol, nebulized treatments, cardiac drugs, aspirin, nitroglycerin, emergency drugs for emergency allergic reactions such as epinephrine. Also, an EMT can administer liquid Tylenol, Zofran, oral glucose, and oxygen as well. Naloxone is a drug that the general public can administer, but is also recognized and acceptable in West Virginia for a basic EMT to administer in the case of an opioid overdose. So West Virginia basic EMTs per protocol have the permission to administer a 12 lead to a patient of any cardiac patient or any cardiac event. Those 12 leads can be also sent to the receiving facility via Bluetooth straight from our ambulance. Those go to the ER as well as the cath lab, and the doctor can already see that 12 lead of that patient if they're having an acute myocardial infarction or what's commonly known as a heart attack. The cath lab is already alerted, and that patient goes straight to the cath lab. That cuts down on the amount of time that the patient would be spent either stopping in the ER or trying to call and get someone to look at that 12 lead. That's already done, and that speeds up patient care, which ultimately improves survival rates in West Virginia. During the ride time, the whole purpose is for the student to obviously have observation, but as well as get additional information. They'll be riding with a preceptor. The preceptor is a designated preceptor that assists those students in teaching, not just only letting the student observe, but the student gets to do the hands-on procedures that they've been trained to do at that point in time in their level of class. But also it's the whole goal of actually seeing, doing, and then following up and explaining why this is done. You may see it in the book, you may have read it through your PowerPoint, you may have heard it once or twice, but actually seeing it and then having that re-emphasized while they're out there in a real life situation really drives that message home to our students. So the National Registry is a certifying body that once a student successfully completes the computer adaptive exam, it ensures their competency to perform and function as an EMT in the pre-hospital setting. The student can then take that National Registry certification and receive a card in multiple states and actually perform as an EMT.
Okay. I like it. Perfect.
God, that's awful.